I want you to imagine, just for a moment, that you're facing a major surgery. Let's say it's a total knee replacement.
Oh, yeah. That is a heavy one.
Right. Because on one hand, there's this immense bright hope. You're looking forward to moving freely again, getting your life back.
Chasing the grandkids around or just like walking down the stairs without wincing.
Exactly. But right alongside that hope, there's a very real, very heavy sense of dread.
Oh, absolutely. The dread of the recovery.
Yeah, because you're essentially trading one type of suffering, the chronic joint pain, for acute surgical trauma. And, the chemical fog from the heavy painkillers that usually follow.
It's a really brutal trade-off for a lot of
It
people.
is. But what if the solution to reducing that heavy medication wasn't a different drug? What if it was an auditory illusion?
I know, it sounds like science
It
fiction.
really does. But welcome to today's deep dive. Our mission today is to explore exactly that. We're going to see how a simple, entirely auditory trick might drastically reduce the need for strong opioids after major surgery.
It is such a fascinating topic.
It really is. And we're pulling from two great sources today. A peer-reviewed medical report from Medical Devices and Surgical Technology Week from May 2022 detailing this wild clinical study from Italy.
And we also have a great health blog post that translates what all this clinical data actually means for everyday recovery.
Right, for your everyday life.
Hmm.
Okay, let's unpack this.
Well, to really appreciate the magnitude of this, we first need to kind of ground ourselves in the physical reality of the patients we're talking about here.
Right, set the scene for us.
So the medical report focuses on older adults undergoing total knee joint replacement surgery.
Okay.
And they are receiving spinal anesthesia. Look, a knee replacement, it is not a delicate procedure.
No, I mean, it's practically carpentry.
It really is. It's a major physical trauma to the body. And the traditional medical approach to managing that postoperative recovery relies heavily, heavily on opioids.
Specifically morphine.
Exactly, morphine. And while morphine is incredibly effective at blocking pain signals, it comes with a steep physiological cost, especially as we age.
Yeah, the sources point out that reducing opioid use in older adult patients is critical.
Because the side effects aren't just like mild inconveniences. We are talking about intense nausea, severe constipation that can lead to its own set of medical complications.
Right, it cascades.
It does. Plus respiratory depression, where the breathing becomes dangerously shallow, and this profound cognitive fog or delirium.
It's like using standard opioid painkillers is like using a sledgehammer to fix a clock.
That is exactly what it's like.
Like you stop the pain signal, sure. But the collateral damage can be rough on an older body. It's like cutting the main power line to your house just to turn off a buzzing light bulb.
Right, and the buzzing stops, but now you're in the dark.
Exactly. The fridge is off, the alarm is dead. You're stopping the pain, but damaging this fragile aging system. So how exactly did this Italian anesthesia department, the one at the Santa Maria Maddalena Hospital in Volterra, how did they decide to use something as abstract as sound as a non-pharmacological premedication to replace that sledgehammer?
It's brilliant, actually. They recognize the exact problem you just described. And they designed a highly rigorous study to test this sound intervention on 40 older adults.
And this was a prospective, single-center, randomized controlled study, right?
Yes, which, as the blog source notes, is the gold standard for trustworthy medical research. They didn't just look backward at past data.
Right.
They randomly assigned patients to different groups to eliminate bias and carefully controlled the variables.
Okay, so you have a prestigious Italian anesthesia department dealing with serious orthopedic trauma, and they use a sound wave as a pre-surgical medication. I need to know the mechanics of this.
Okay, so the intervention they used in the preoperative holding area is a perceptual phenomenon called binaural beats.
Binaural beats.
Okay. Yeah. And according to the medical report, auditory binaural beats occur when tones of two slightly different frequencies are presented simultaneously, but separately, to each ear.
Meaning one sound on the left, a different sound on the right.
Exactly. The key here is that the brain doesn't just passively hear two different sounds, it actively processes the mathematical difference between them.
Here's where it gets really interesting, because it's not actually a sound that exists in the physical room.
Right.
It is a manufactured frequency that your brain builds from scratch. It's kind of like, think about when you're sitting at a red light and you're behind two cars with their turn signals on.
Oh, yeah, the blinkers.
Yeah, and one is ticking just a tiny fraction of a second faster than the other. At first, they're totally out of sync, but then they slowly sync up into a single click and then drift apart again.
Yes, that phase shifting.
Right.
Yeah.
Eventually, your brain starts to perceive a third, pulsing wobble rhythm, hovering between the two separate rhythms.
That is the perfect analogy. And in this study, the Italian researchers were incredibly precise with the frequencies to force the brain into creating a very specific wobble.
What were the exact numbers?
For the 20 patients in the intervention group, they had a 256 hertz tone played into one ear and a 260 hertz tone played into the opposite ear.
Okay, so 256 in one, 260 in the other, leaving a difference of exactly 4 hertz between the left ear and the right ear.
Exactly. And because those two tones are isolated, they used stereo headphones to make sure the left ear only heard 256 and the right ear only heard 260s. The brain attempts to reconcile that slight conflict.
And that reconciliation creates the phantom beat.
Yes, phantom beat of exactly 4 hertz. The brain starts resonating with a frequency that isn't actually entering the ear canal at all. It's an illusion created entirely within the auditory processing centers of the brain.
Wow. So the brain is literally generating its own internal metronome. But, you know, scientifically, you can't just trust that the 4 hertz beat did the job on its own. You'd need to compare them against a group listening to a baseline tone. Otherwise, someone could just argue that listening to any humming sound in a quiet room relaxes a patient.
And that is the beauty of their randomized controlled design.
Right, the control group.
Yes, the other 20 patients also sat in the preoperative holding area. They wore identical stereo headphones, connected to the same laptop, running the exact same audio generation program, a software called Binaural.
But they didn't get the mismatched frequencies.
Correct. The control group received an acoustical stimulation of 256 hertz in both ears simultaneously.
So no difference in frequency. 256 on the left, 256 on the right, just a flat, steady tone.
Exactly. And because the frequencies were identical, their brains were not forced to reconcile a difference. No 4 hertz phantom beat was created.
Okay.
So both groups received acoustical stimulation before the surgical procedure even began, but only half of them experienced the binaural beat.
Okay, we have the setup. 40 older adults, understandably nervous about having their knees replaced, sitting in the pre-op area with headphones on.
Yeah.
Half are generating this 4 hertz auditory illusion inside their minds. Half are just hearing a steady tone. Then the surgery happens. They get the spinal anesthesia, the joint is successfully replaced, and they wake up in the recovery ward.
Right. That's when the real test begins.
So how did the medical team measure the actual impact of that phantom beat once the anesthesia wore off?
They tracked it by looking at cumulative self-administered morphine consumption.
Using one of those little buttons the patient presses.
Exactly. Patient-controlled analgesia. It empowers the patient to manage their own post-operative pain. Whenever they feel the pain becoming intolerable, they press a button to safely deliver a controlled dose of morphine directly into their system.
And they monitored this for the first post-op day.
Yes, the entire first 24 hours.
Well, the numbers on this are just staggering.
They really are.
The control group, the patients who just heard the steady tone, they used an average of 11.85 milligrams of morphine on that first day.
With a standard deviation of plus or minus 7.71.
Right. But the binaural beats group, the ones who had that 4 hertz phantom rhythm echoing in their brains before the operation, they used an average of only 5.75 milligrams.
Plus or minus 5.25.
I mean, they essentially cut their morphine use in half.
By more than 50%, just from a brief audio track played before the first incision was even made.
That is a massive, tangible reduction in the need for a heavy, system-altering narcotic.
It is. But what's fascinating here is a massive paradox buried deep in the data.
A paradox.
Yeah, because, you would logically assume that if a patient is self-administering half the amount of morphine, they must be experiencing significantly less physical pain.
Well, yeah. Wait, if their pain perception was exactly the same, wait, are you saying it was the same?
I am. The researchers measured feelings of pain every 8 hours using a standard numerical rating scale. They also evaluated baseline feelings of dread and anxiety using validated psychological testing, the State Trait Anxiety Inventory.
Just to ensure one group wasn't naturally more anxious than the other.
Exactly. And according to the peer-reviewed data regarding pain perception, no differences between the groups were captured.
Wait, really?
Really? Furthermore, the massive drop in morphine consumption did not correlate to the anxiety measures either. Their self-reported pain levels and their self-reported anxiety levels were mathematically identical across both groups.
Okay, I am genuinely struggling to wrap my head around this.
I know, it's wild.
If they are circling the exact same frowny faces on the pain chart, feeling the exact same level of distress from the surgical site, Why on earth did the binaural beat group reach for the drug half as often?
It is the ultimate puzzle of this study, and it forces us to look at the difference between nociception and suffering.
Okay, break that down for us. Nociception.
Nociception is the raw data of pain. It is the physical nerve signal traveling up from the traumatized tissue in the knee to the brain saying, hey, tissue damage has occurred.
And that signal was identical for both groups.
Yes. The surgery was the same, the tissue damage was the same.
But suffering is different.
Exactly. Suffering is the psychological interpretation of that raw data. It's the panic, the distress, the feeling of being totally overwhelmed by the nociception.
Oh, I see.
The data suggests that our behavioral response to those pain signals was profoundly altered by an auditory illusion experienced hours earlier.
So the 4 hertz phantom beat didn't act as a localized anesthetic to block the nerve signal. It seems to have acted as like a psychological fortifier.
Yes. It altered their threshold for intervention. The pain was undeniably there, registering as a 7 out of 10 on the chart, but their brain was somehow fortified to endure it.
They registered the signal but subconsciously decided, I feel this, but I don't need to cut the main power line right now. I can sustain this moment.
Exactly. And we actually know that the 4 hertz frequency falls into the theta wave category of brain waves.
Okay, theta waves. What do those do?
They're typically associated with deep relaxation, meditation, and the early stages of REM sleep. So by forcing the brain to resonate at 4 hertz before the trauma of surgery, the Italian researchers may have effectively primed the patient's nervous systems.
Like they build a temporary reservoir of cognitive resilience.
Beautifully said, yes. The medical conclusion of the report is incredibly clear. This binaural beat intervention is safe, inexpensive, and completely non-invasive.
And it positively affects postoperative recovery without extra drugs or complex equipment.
Just a laptop and a pair of stereo headphones, it really democratizes the idea of support. It proves that highly effective medical options can sometimes be incredibly simple and kind to the body.
Yeah, simple and kind. I love that. So if this 4 hertz beat didn't actually numb the tissue, but fundamentally changed the patient's relationship to the trauma, it makes you wonder what these audio illusions could do for, the lower stakes traumas of our daily lives.
Exactly. And this is where our second source, the health blog post, takes this clinical data and really applies it to our living rooms.
Right, because if we connect this to the bigger picture.
Well, if we connect this to the bigger picture, the blog points out that while this specific study was confined to one pre-surgery session, it adds incredible weight to a growing body of evidence.
Evidence about sound and wellness, right?
Right. Evidence showing how thoughtful sound experiences can fundamentally help people feel steadier in the world.
The blog makes this really beautiful pivot. It points out that music and targeted sounds can create profound calm and support relaxation far outside the hospital walls.
Yeah, it doesn't have to just be for surgery.
Exactly. It suggests that regular listening to music you enjoy, or specific intentionally designed soundscapes, can serve as a gentle, pleasant habit to create moments of peace during challenging times.
Because if a highly structured 4 hertz sound intervention can have morphine use in an orthopedic recovery ward just by altering a patient's threshold for suffering, the blog asks us to consider what informal sound interventions might do for our daily stressors.
Oh, like a difficult day at work.
Or a stressful commute, navigating personal conflict. These are all forms of distress where our threshold for suffering is constantly tested.
So what does this all mean?
I think it means that building enjoyable listening habits costs absolutely nothing extra.
Right. It feels good in the moment, but more importantly, based on this gold standard scientific research, tuning into thoughtful soundscapes might just be secretly fortifying your overall sense of well-being.
Exactly. Small, enjoyable habits with sound might be quietly building your internal resilience for whenever you face your own version of a stressful event.
You're practically banking neurological fortitude.
You really are. It is a profound shift in how we view the media we consume. We so often think of music, podcasts, or ambient sound as mere entertainment.
Just background noise to fill the silence.
Right. But this deep dive reveals that auditory input can act as a biological primer. It interacts with our nervous system in ways that echo for hours, fundamentally changing how we process physical and emotional stimuli.
So just to wrap this all up for you listening, a simple 4 hertz auditory illusion, created by playing 2 slightly different frequency tones into isolated ears, was administered through stereo headphones to older adults before major knee replacement surgery.
And despite reporting the exact same levels of physical pain and psychological anxiety as the control group, the patients who experienced that phantom 4 hertz beat subconsciously required half the amount of self-administered morphine during their first 24 hours of recovery.
It's just a stunning testament to the fact that sometimes effective medicine isn't a pill you swallow. Sometimes it is a mathematical frequency your brain creates out of thin air.
And, this raises an important question.
Oh, lay it on us.
If a brief, targeted audio track played before an operation can subconsciously alter a patient's physiological need for heavy narcotics a full 24 hours later,
Yeah.
how might the chaotic noise we endure on a crowded street, or the soothing soundscapes we deliberately play in our homes, be secretly programming our physical health right now?
Wow. It makes you rethink everything you expose your ears to, doesn't it? The next time you find yourself dreading whatever comes next, remember that your brain is incredibly powerful and highly suggestible. You might not need to cut the main power line to find relief. You might just need the right rhythm to help you find your steady ground again.